Hi, welcome to the 10th edition of NH Dialogues. 28th of July is celebrated across the world as the World Hepatitis Day. And the theme for this year's World Hepatitis Day is elimination of hepatitis from the face of this earth. It's a very wishful thinking because you will be surprised to know that 4% of Indians are hepatitis B positive. 1.5% Indians are hepatitis C positive. It is an extremely large number for a country like ours with very poor resources. In any case, we have to now try and treat the ones who have hepatitis B and C and make sure that no one else will get it. And it is possible. Western world has proven that it is possible to eliminate hepatitis B and C. But for this to happen, we need to have the knowledge. We need to educate people. And to educate people, we have three of the stalwarts in managing the hepatitis. They are the hepatologists and gastroenterologists. Next to me is Dr. Sandeep Pal. He is a hepatologist and gastroenterologist from Rabindranath Tagore International Institute of Cardiac Sciences, Calcutta. And on my left side, it's Nikhil Bonade. He is the medical gastroenterologist interested in hepatology at the Health City in Bangalore. And my far right is Dr. Amit Kumar Sanghi. He has come from Narayana Health in Jaipur. He is again an expert in treating hepatitis, and he is a medical gastroenterologist and hepatologist by profession. First question to you, Sandeep. This is a question from Sairam from Andhra Pradesh. How to prevent hepatitis B and C?
Yes. So hepatitis B, for the prevention of hepatitis B, it's very clear we have an excellent vaccine in the market, it's available. So by vaccination, we can eliminate hepatitis B, we can protect against hepatitis B. So the vaccination schedule is, there are 3 injections which you have to take at 0, 1 and 6 months. And that gives adequate around 90 to 95% protection. But again, I want to stress that taking the vaccine itself is not enough. After taking the vaccine, we have to check for the protection level, whether the individual is protected after vaccination or not. So it is wise to check on anti-HBs titer. And if the level is more than 10, then he is adequately protected from hepatitis B. For hepatitis C, unfortunately, we don't have any vaccine, and it is very difficult also to manufacture any vaccine against hepatitis C. But for both together, hepatitis B and C, as they are transmitted through bloodborne infection, we have to take the universal precautions, like like for the injection drug, intravenous drug abusers, they get usually hepatitis C. So we should educate the public not to share needles, not to share razors with persons who has this infection. And another important route of transmission is mother-to-child transmission for hepatitis B, so and also C to certain less extent. For that, we have to investigate the mothers during pregnancy, see the DNA level in the females in the 3rd trimester, and if the DNA level is very high, usually we should treat. If it is more than 10 to the power 8 level, then usually treat. If it's not treated also in the newborn, within 12 hours of birth, we have to give vaccine to the newborn. That is both active and passive immunization, the vaccine as well as immunoglobulin.
Thanks, thanks Sandeep. Next question to you, to Nikhil, is from Jaswantra Sanal from Vadodara. His question is, what is hepatitis B and what is its effect and what precaution is required?
Yeah. First of all, what is hepatitis B? So hepatitis B is a small circular DNA virus. It's a double-stranded virus which predominantly infects the liver in the human body. So the route of, how does one get infected with hepatitis B? The most common mode of infection is bloodborne or through a sexual route, because the vaginal and the seminal secretions contain large amount of hepatitis B, and the most important mode of transmission is a vertical transmission where the baby gets it from the mother. So what are the effects of hepatitis B? So hepatitis B, as I said before, infects the liver. It can be either an acute or a chronic infection. In acute infection, more than 95% of them, they clear by their own immunological system. And when it comes to chronic infection, the infection can stay as a chronic active hepatitis. It can stay as in a carrier state for lifelong. And in some patients, this infection can progress to decompensated liver disease, that is cirrhosis, and end stage would be a hepatocellular carcinoma. So it has got a varied presentation. So it can just be an acute or chronic, going on to produce cirrhosis and liver cancer. So taking all this in the background, so one needs to be very careful so that one does not get hepatitis B. So now we have, as my friend Dr. Sandeep just told, that we have a vaccine for hepatitis B, which as a universal health protocol is given to everybody who is born in India. So that vaccine prevents the infection, but you also have other routes where you have to have safe sexual practices, avoiding promiscuity and not to have multiple sexual partners, that is 2. And number 3, as he has rightly told, to avoid sharing of injections or razors, so that you try to avoid it. So this is what it is.
Thank you. Thanks, Nikhil. The next question is to Dr. Amit Kumar Sanghi. Amit, Mr. Rahul Dey from Kolkata wants to know, what are various investigations done to rule out different types of hepatitis?
Before go for investigation, we need to find some questions from the person himself, that there is any history of prodrome such as fever, anorexia, vomiting, joint pain, and is there any exposure to any type of toxins such as alcohol or drugs such as hormonal preparations, alternative medicines, and if is there any history, family history of liver disease in the family. And after that, once we find that there is these questions help to find out that this condition is acute or chronic, then we decide that which investigation is required. There is a few blood investigations that are very easily available, and the most common causes of hepatitis can be ruled out. For example, hepatitis A, hepatitis E is the most common causes of acute hepatitis, and which can be diagnosed with blood investigations. Similarly, hepatitis B, hepatitis C can also be diagnosed with blood investigations. For alcoholic hepatitis, the history of significant amount of alcohol for a long term can help to diagnose that this liver injury or hepatitis is because of alcohol. And once we rule out all these causes, these are common causes, then we move to for rare causes, for example for autoimmune hepatitis, for which we need again blood investigations, and we can diagnose these cases with these blood investigations.
Thanks. Thanks, Amit. Next question is, before that, Nikhil, did you say that hepatitis B, yes, 90% of the acute hepatitis B, yes, doesn't become chronic?
Yes.
Oh, that's a good news. Yes. Okay, because whenever I hear somebody has developed hepatitis B, I thought invariably everyone in the end land up with chronic hepatitis B. But will they remain as hepatitis B positive?
No, sir, it depends. If they have seroconverted, then they don't remain.
They don't remain. Excellent. Thanks. The Sandeep,
Yes.
Muzam Hussain from Bangladesh wants to know, I am hepatitis B positive, but inactive. What should I do for a safe living?
Yeah, so from this question, it appears that he is in a chronic carrier state, inactive carrier state. So again, chronic hepatitis B has got stages. For simplicity, I will just say it can be inactive or it can be active. So most probably he is an inactive carrier state. So here you have to check his DNA level. So if there are some guidelines for treatment, if the DNA level is more than 20,000 in E antigen positive, then only we will treat. Or if the DNA level is more than 2,000 in E antigen negative, along with if HGPT is more than 1.5 times of the normal, then these are the guidelines of treatment. So he doesn't require treatment right now, but he has to investigate. So the protocol is every 6 months we do few investigations, like we will advise him to check his DNA levels, the LFT, and ultrasound of the upper abdomen just to look at the liver, and we check alpha fetoprotein, because as I have said earlier, hepatitis B, this is a very carcinogenic virus. Without causing cirrhosis, sometimes it can cause tumor in the liver. And then for the other things, like for his family point of view, he should check his family members. If he is married, he should check his wife if she is hepatitis B positive. If she is not, then she should be vaccinated. The kids he have to check, then they have to vaccinate his family members.
Thanks, Sandeep. Next question to you, Nikhil, is from Nikhil Gare from Jalgaon, Maharashtra. How liver diseases can be avoided?
Good question. Yeah, so in a simple sense, if you want to categorize liver disease, you have something called an acute infection of the liver and a chronic infection of the liver. Most of the acute infections you get in our subcontinent is hepatitis A and hepatitis E. So these are not bloodborne, these are by fecal-oral contamination of water and food. So safe hygienic practices need to be advocated and practiced to avoid this, number one. And number two, for hepatitis B, as already have told, vaccination is the only precaution we have. And unfortunately for hepatitis B, you don't have any vaccines available. So coming to the other part where you have alcohol liver disease causing alcoholic cirrhosis. So alcohol again is a substance abuse. So the population, the general public, they should know that alcohol has a potential toxicity to cause permanent liver damage. So that also is there. So if you avoid drinking alcohol up to a serogenic dose, and in India we take the serogenic cutoff as about 40 to 80 grams of alcohol per day for men and 20 to 40 grams of alcohol per day for females. So with this, in the absence of any history of background liver disease, then this should not be a potential thing. Number three, there are some things which are called inherited liver diseases where you can't avoid it, you get it by your genes. So one among it would be a hemochromatosis. At this point, the parents when they're pregnant can be given a genetic screening. And the last and perhaps the most common of it is a drug-induced liver injury causing permanent hepatic failure. So drugs, in our country, most of the population who are from rural background, say perhaps, so they have this practice of visiting a native doctor whenever somebody has jaundice. So that I think should be avoided because what the native doctors give has a lot of toxic elements to it and it can cause toxic hepatitis. So most of our patients who have hepatitis are infective hepatitis, which most of them are self-limited. So I would tell them not to take anything native medicines which can cause a toxic liver injury. So this is what. Yeah.
Thank you, Nikhil. The number of people who are consuming alternative medicine in this country is huge. I'm not criticizing alternative medicine. I'm sure some of them are extremely good. But we should know the side effects of every medicine. Just getting a packet of powder without really knowing what it is can really hurt the kidneys or the liver. Next question to you, Nikhil, is from Jiv Dinshaw from Surat. Is hepatitis C and liver cirrhosis curable?
Yeah, good question. Again, hepatitis C, is it curable? Yeah, definitely. Because now in 2016, we have got certain drugs which are called directly acting antiviral agents. So these drugs have come up recently in the market, and these drugs are extremely expensive in the Western world, but we get it at a very reduced cost in India. and these drugs have got a potential to cure and eradicate hepatitis C from the body. So that is why I think hepatitis C is definitely curable, number one. And number two, is cirrhosis curable? So cirrhosis, one must understand, is an irreversible process in which liver undergoes a permanent damage. So cirrhosis perhaps is not curable, but now we have what is known as orthotopic or liver transplantation, in which we can transplant the liver and cure the cirrhosis.
Excellent, excellent. Next question to you, Sandeep. Yes. This is from Hassan from Dhaka. My DNA is 4 lakh and I am a hepatitis B positive patient. How to take care of my life?
Yeah, so he has told his DNA hepatitis B, whereas DNA is 4 lakhs, which is very high viral load, we would say 4 lakhs. But what we don't know is his E antigen status, because the treatment depends on the E antigen status. Anyway, the count is so high, he will require treatment. But if it is E antigen positive, then there is slight variation in the drugs we choose. So there are 2 drugs which is available, orally available drugs now. One is tenofovir, another is entecavir. So either of them we can prescribe to him. So there is no definite guideline which drug we should give, but that depends on the side effect profile also. Tenofovir is a little bit kidney toxicity in the kidney, so we can give, and the price also it differs. Entecavir is more costlier than tenofovir. So either of them we can prescribe. And start the treatment and see. We have to, other things we have to investigate, like we have to know his LFT, how is it, and what is the stage of the hepatitis B. That is most important. If it is acute or chronic. If this is an acute hepatitis, even 4 lakhs we won't treat. But if it is a chronic hepatitis, then we have to treat. So how to know whether acute or chronic? There is an investigation which we do, like IgM anti-core antibody. There is an investigation called IgM anti-HBC. So if that antibody is positive, that means it is an acute hepatitis B, and this is the immune response of the body where the DNA is so high. So we may not treat that condition. So we'll keep him under close monitoring and we'll repeat the investigations and see. But if it is with the chronic hepatitis B, this needs to be treated.
Thanks. Thanks, Sandeep. Next question to you, Amit. This is from Salahuddin from Bangladesh. About 12 years ago, I was told to be hepatitis B positive. My DNA report was negative at that time. 4 months ago, my pathological report, SGPT and SGOT, also improved. But even now, I am hepatitis B AG positive. Please tell me, how can I get relief from this problem?
First of all, chronic hepatitis B is incurable. So HbS-Ag in most of the cases remain to be positive. The aim of treatment in chronic hepatitis B to reduce the HBV DNA level and undetectable level. And there are the few tests that suggest that if they come to be, for example, if patient is, as Dr. Sandeep said, that before treatment we need to know HBe antigen status. If patient HBe antigen positive before the treatment start, and now his HBV DNA is undetectable and anti-HBe antibody is positive and HBe antigen is negative, then we can try to stop the medicine. But most of the cases this is not possible for today antiviral therapy, and you need to continue this antiviral therapy for at least 3 to 4 years. Once there is one guideline that suggests that after when the DNA level is undetectable, we can stop medicine after 1 year of undetectable DNA, but with the risk that there is a relapse in around 1/3 patient they have.
Thanks, Amit. Nikhil, there is a question for you. This is from Siam from Bangladesh. What is the most appropriate management after the diagnosis of hepatitis C?
So first coming to the diagnosis. So diagnosis is by serology when you have anti-HCV antibody positivity. So once we know that, then we need to know there are particular genotypes in hepatitis C. It is 1 to 6. So but in the subcontinent, including Bangladesh and Pakistan, we have more of 1 and 3, genotype 1 and 3 more common than 2 and 4, which is there in the Western world. So we need to know the genotype first, and after we know the genotype, we also want to know the HCV RNA viral load, which is a quantitative assessment of the viral load. So after we know the genotype and viral load, then we can definitely treat them. Depending upon the genotype and viral load, we have again directly acting antivirals. So we have something called sofosbuvir, which has revolutionized the treatment of hepatitis C throughout the world. So along with that, we have other drugs. We have either ledipasvir or a daclatassavir, depending upon the genotype we treat them. So we treat them for a duration of 12 weeks if it is compensated, or we can increase up to 24 weeks. So at the end of 4 weeks, we do what is known as a EVR. So we assess for the viral load, and we assess whether there is a more than a 1 log 10 drop. So depending upon that, we again check the viral load at the end of treatment at the end of 12 weeks, and if required, then we also continue the treatment for up to 24 weeks. So before this sofosbuvir and directly acting antivirals were available, we had something called interferon, and we used to add ribavirin. So these used to have a lot of complications. These used to suppress your blood and immune system. So now with the new drugs, these complications and adverse effects are less. Including cirrhotics, they take these drugs well, and we have very good cure rates in cirrhotics as well.
Excellent, excellent. Good news.
Yes.
Because, when I was a young medical student, if somebody is diagnosed as hepatitis B or C, it's essentially writing a death sentence. Yeah, things have changed dramatically. Yeah. Next question to you, Sandeep. This is from Abhishek Sen from Tripura. My SGOT, SGPT levels are sometimes get increased, sometimes up to 70, or sometime up to 150. But HCV and hepatitis SAG, HBsAg is normal. Why does this happen?
So he has this, what we call in medical terminology as transaminitis. That means his SGOT, SGPT levels are high. So there are other lot of causes other than hepatitis B and C which can increase the levels of SGOT, SGPT. So basically, increase in the SGOT, SGPT levels means that hepatocytes are getting destroyed in the liver, because these enzymes, they remain inside the hepatocytes. So when the hepatocytes get destroyed, they get released in the blood. So the most common etiology other than viral etiology, as you said, viral is negative, is the fatty liver disease nowadays. This almost 30 to 40% of our population has got what is called non-alcoholic fatty liver disease. So if he is a non-alcoholic, if he drinks alcohol, then again SGOT, SGPT can get raised. So other than if he is a non-alcoholic, the other cause can be non-alcoholic fatty liver disease, which is usually associated with the metabolic syndrome, which means if he is a diabetic, if he is obese, if he has a dyslipidemia, if his lipids are increased. So these things we have to check. Other metabolic things, like if the uric acid also is increased, hyperuricemia is associated with this. So other cause, when we don't find any, if he has no features of non-alcoholic fatty liver disease also, then other investigations we have to do, like if he is a young patient, we have to check the copper levels. Wilson's disease we have to rule out, which is again one frequent, is a common cause. So to diagnose Wilson's disease, usually we do serum ceruloplasmin level and 24 hours urinary copper levels. Then there are other very rare causes, as Nikhil has said, like hemochromatosis. These are rare level. The most common causes are viral etiology, then Wilson's disease, non-alcoholic fatty liver disease, alcoholic liver disease, and another most important, as Nikhil said, is drug-induced. If he is taking an alternative drug or some drugs for to build his body, that's the most common history you get in clinical practice. That someone is taking some drugs, some going to gym and they take some drugs.
Oh, it can affect the kidney.
Yes.
I mean, it will affect the liver.
Yeah, because most of these they contain some anabolic steroids or something because of this health building stuff.
Another important drug is anti-tubercular drug.
Anti-tubercular drug. Okay. So we have to take adequate history of drugs, toxins. If he is taking a homeopathic drug, Ayurvedic drug, anything which we don't know, we have to take that history.
Thanks, Sandeep. Fascinating.
Yes.
There are so many things what we do, including doctors, without really understanding how it can affect the liver. Yeah. Nikhil, Dr. Zishan from Mangalore want to know what are the causes of cirrhosis in childhood
Yeah, so basically the most common cause or the commonest of causes of cirrhosis in childhood would be a developmental anomaly of the biliary tract. So as you might know, it is a biliary atresia. That is the most common thing, which is they have a embryological development issues and they have atresia of the biliary tract and causing cirrhosis. And after that you have choledochal cysts, you have long-standing biliary obstruction because of biliary strictures, you have stones. These can cause. Next, coming to the next group where you have other than developmental and embryological anomalies could be metabolic liver disease, like the glycogen storage disorders and the metabolic liver disease basically. And in young you have something like autoimmune hepatitis type 2, and you also have a Wilson's disease, and you have mitochondrial hepatopathies of the liver. And there is something known as Algil syndrome and familial progressive intrahepatic cholestasis. These are some of the rare causes. Basically, what happens is that the child is known to have any liver disease because the most important symptom would be failure to thrive. That would be the thing. And after that, more important should be given in nutrition, because during childhood and adolescence where the development and growth takes place, so nutritional abnormalities should be given more importance in cirrhosis. Otherwise, most of the childhood cirrhosis can have portal hypertension and complications as same as adult disease. And now with transplantation becoming, liver transplant in children becoming more and more rampant, so these children, they are known to live a good life after the transplant is over.
Thanks, Nikhil. Amit, Mr. Aravinder Singh from Kolkata wants to know, how is hepatitis B spread? How long does the hepatitis B virus survive outside the body?
As my colleague said that hepatitis B is a blood-borne infection, and it can be spread by percutaneous, ocular and mucous membrane exposure of contaminated body fluids. Contaminated body fluids means hepatitis B virus is seen in the blood products such as plasma, semen, saliva. In all these body fluids have hepatitis B, and exposure of these body fluids can transmit hepatitis B. One of the important things that hepatitis B is 100 times more infectious than HIV and 10 times more infectious than HCV in transmission of such transmissions. And as my colleague said that the hepatitis B transmission can occur through perinatal transmission from mother to child, unprotected sexual intercourse, and the man who sex with the man, and healthcare workers who expose such infected body fluids, and hemodialysis patient. All these are the high risk patients where we need to screen these patients regularly. And second question, that hepatitis B survive for at least 7 days from outside the body.
7 days?
7 days outside the body.
That's very scary.
Yeah. So
very scary. Yeah. Normally these viruses, the moment they come out of the body, they don't survive, isn't
HIV
it?
survival, I think 1 hour or 1 or 2 hours.
Okay.
But hepatitis B survive for at least around 7 days.
Because of its structure.
Excellent. Now the last question to Sandeep. Very interesting question, because this is a question which is asked by so many patients. It's from Raji Baumik from Alipurdwar, Calcutta. I have grade 2 fatty liver. I am non-alcoholic and pure vegetarian. What is the treatment?
So as we all know, nowadays it's the epidemic. Obesity is like epidemic. It's going on in the society. If we see whether it is childhood obesity or adult, so this is a metabolic problem, non-alcoholic fatty liver disease. It's usually associated, as I have said earlier, with hypertension, diabetes, hyperuricemia, obesities. So first of all, we have to see the other risk factors. We have to see whether he is obese or whether he has got dyslipidemia. If he is dyslipidemic, his cholesterol we have to treat. This is another again frequent question we get from our colleagues whom we practice. Can we give atorvastatin to this group of patients? So there are enough studies which shows that we can give atorvastatin to these patients because decreasing their levels, LDL levels and the total cholesterol level is very important. And usually this type of patients, they have increased triglycerides, which we have to treat with fenofibrate group of drugs. So for the treatment of fatty liver, all the studies that have shown the most important strategy to treat fatty liver disease is physical exercise and weight loss. So even 5 kilos of weight loss, even around 5 to 10% of weight loss has shown to have histological improvement in the liver.
Excellent.
That has shown. So the
exercise.
So
diet.
Exercise, diet. So the most important strategy is weight loss. You have to do physical exercise, routine exercise, and low-fat diet. And that there are certain drugs which helps. So drugs in fatty liver only we prescribe if the SGOT, SGPT levels are high. Usually SGPT levels are high. So for a diabetic patient, if the SGPT level is high, usually the drug of choice is pioglitazone, the glitazone group of drugs. And for a non-diabetic patient, we give antioxidants, vitamin E. Vitamin E is a very powerful antioxidant because no matter whatever is the cause, the end point of liver injury is free radical mediated injury to the liver. So if we give powerful antioxidants like vitamin E, usually in my personal practice also I have seen the SGOT, SGPT levels will definitely improve with vitamin E. But whether it is causing histological improvement in the liver, that is not much proven. But only histological improvement is with physical exercise and weight loss. And there are few new drugs which are in the pipeline, like one is obeticholic acid. It is like ursodeoxycholic acid. There is one more drug coming, obeticholic acid. But it is in the phase 2 trials, phase 3 trials are going on. It's a very promising drug. We are all waiting for the drug because this is now the most common causes of cirrhosis. Non-alcoholic fatty liver is the most common of cirrhosis, and sometimes few patients we have also, this patient also develop hepatocellular carcinoma incidence is also very increased in this group of patients.
I must admit, I learned so much about hepatitis and its complications. Looking forward to seeing you again in the near future with a very, very interesting topic which will be close to your heart. Thank you very much. Bye.